Hello. Today I will demonstrate the deep muscles of the flexor compartment of the forearm, which includes three muscles. One is the flexor pollicis longus, number two is the flexor digitorum profundus, number three is the pronator quadratus. So I'll demonstrate the origin, insertion, nerve supply, action of all these three muscles, which are the deep muscles in the flexor compartment of the forearm. And this is one of the most important uh, exercise for the practical examinations, which is asked as a minor. Okay. In order to see the deep muscles of the flexor compartment of the forearm, I have cut the long tendons of the superficial group of flexor muscles in order to proceed to the deep muscles. There are three deep muscles in the flexor compartment of the forearm. One is the flexor pollicis longus. Next we have the more bulky muscle of this, which is the flexor digitorum profundus, and we have the pronator quadratus. Okay. So I am reflecting the superficial muscles. This is the flexor distance. This is the palmaris longus tendon. This is the flexor pollicis, flexor carpi radialis, and these are the muscles which are the flexor digitorum superficialis. Now, once the tendon were cut, these are the cut end tendons of flexor digitorum superficialis. Yeah. Now, once if you can see these tendons, now these are the flexor digitorum profundus, flexor digitorum profundus. This flexor digitorum profundus muscle, this is the bulkiest muscle of the forearm, which is deeply seated, and this takes origin from the anterior and medial surfaces of the upper 3/4 of the shaft of the ulna, and also it includes the medial surfaces of the coronoid process and the olecranon process of the ulna. And not only that, this muscle will also take origin from the interosseous membrane. Now moving on to its insertion, this muscle ends as a four tendons. You can see these are the four tendons. These are the four tendons of the flexor digitorum profundus. Okay, and here the tendon of the index finger will separate earlier in the forearm, but rest of the tendons remains united until they appear in the palm. So this is the tendon which is moving to the index finger, which is separated from this muscle earlier, and the other tendons are together fused until they reach to the palmar surface of the hand. Insertion of these tendons, if you see, these tendons, they move in the carpal tunnel, okay, and as these four digits separate in the palm, they provide origin for this muscle. So these are the muscles which are taking origin from the tendons of flexor digitorum profundus. These are the lumbrical muscles. So these muscles, you can see it very clearly. These are the muscles which are taking origin from these tendons. We have four lumbrical muscles. These four lumbrical muscles will take origin from these tendons. So these enter into the fibrous flexor sheaths, okay, and they pass distally, then they pierces the I'll show you one tendon. So they are perforating the flexor digitorum superficialis tendon, and finally this tendon is inserted into the palmar aspect of the terminal phalanx of medial four fingers. So this is the insertion of the flexor digitorum profundus, and this muscle is innervated by two nerves. One is medially by the ulnar nerve, and lateral part of this muscle is innervated by the anterior interosseous nerve, which is a branch of the median nerve. Action of this muscle, if you see, it is these tendons, as they are inserted onto the terminal phalanx, this muscle is it flexes the terminal phalanges of the middle four fingers, and not only that, these tendons also will produce flexion at the metacarpophalangeal joints and the carpal joints. This is all about the flexor digitorum profundus. Then we have a next muscle, which is a flexor pollicis longus. This flexor pollicis longus, this muscle, yeah, this muscle, this is the flexor pollicis longus, which was cut, the tendon was cut. This is the flexor pollicis longus, which is a unipinnate muscle, and This will take origin from the anterior surface of the shaft of the radius below the oblique line, and you know, this muscle, it also takes origin from, few fibers will take origin from the interosseous membrane. And this muscle insertion, if you see, the tendon passes beneath the flexor retinaculum. That means it is also a content of the flexor carpal tunnel, and it passes between the opponent's pollicis and the oblique head of the adductor pollicis, and it get inserted onto the palmar surface of the base of the thumb, distal phalanx of the thumb. So this tendon, so this is the flexor pollicis longus tendon, which is moving deep to the thenar muscles, okay, and it getting inserted onto the distal phalanx of the thumb, and it causes the flexion of the distal phalanx of the thumb, okay. So this is the tendon. You can see this is the adductor pollicis muscle, and this muscle is innervated by again the anterior interosseous nerve, which is a branch of the median nerve, and this action of this is the flexion of the thumb, which causes the flexion of the flexor of the thumb is flexor pollicis longus. Then lastly we have one more muscle, which is the pronator quadratus. You can see this one, deeper muscle. This is the quadrangular shape muscle, as I am separating the flexor distorum profundus tendons and the flexor pollicis longus. This muscle is the pronator quadratus, which is quadrilateral, and it extends across the lower parts of both bones, ulna and the radius bone. Origin, it takes origin from the bony ridge on the anteromedial surface of the lower 1/4 of the ulna, and get inserted onto the anterior surface of the lower 1/4 of the radius. And the nerve supply of this muscle is again by the anterior interosseous nerve, which is a branch of the median nerve, and the action of this muscle is the principal pronator of the forearm. So this is the pronator quadratus muscle. So this is all about the deep muscles of the flexor compartment of the forearm. Thank you.